You can be diabetic without knowing it. Diabetes affects millions of people in the world. It is here in easy and natural. We will tell you about how to take care of yourself and how to know if you have the disease. If you like this type of content, please like us and do not hesitate to subscribe to the channel. By the way, activate the notification bell so that YouTube will notify you when we upload new content. Now let's start the video. In this video we explain in simple words, what is diabetes, type 1 diabetes, type 2 diabetes, consequences of having diabetes, how to take care of yourself if you are diabetic. Let's start. The WHO is on alert. Diabetes is one of the most prevalent pathologies worldwide and cause from sexual dysfunction to having serious kidney problems. In fact, one of the main causes of dialysis is poorly controlled diabetes. It is also one of the main causes of heart attacks and one of the main causes of strokes. In this video, we are going to tell you what is prediabetes, diabetes, what you should know about the most frequent types of diabetes, how to avoid these complications, and how to make a proper treatment. According to the WHO, more than 30 years ago in the world, approximately 100 million people were diabetic. But by 2014, there were already more than 400 million, a figure that is increasing to this day. Thanks to ultra-processed foods, the prevalence of overweight due to stress, and an unhealthy lifestyle, diabetes has taken hold of many people. There are many cases in which people arrive at the emergency room without knowing that they are diabetic, making it necessary in many cases to reach a very complex surgery, such as amputation or, in worse cases, heart attacks. If you are a person who has suffered from this disease or you have the doubt that you could suffer from it, the best thing to do is to go to the corresponding doctor so you can make the corresponding analysis to know if you have it or not. In the case that you do have this disease, you should take care of yourself and not skip any of the steps that your doctor will send you. In case you don't, following a healthy lifestyle routine to prevent this disease will be the best thing to do. That is what this talk is going to be about. This talk is going to be directed to the general public. That is to say, we are going to try to simplify as much as possible. What is diabetes? Basically, it is a clinical syndrome where there is a deficiency of a hormone called insulin or a resistance to it. We speak of an absolute deficiency, that is, the hormone is low or a relative deficiency, although there is more insulin than we need. The insulin does not act properly because there is a resistance in the organism for this hormone to work. Why is insulin important? In very practical and simplified terms, insulin allows sugar to enter our cells. Sugar, medically called glucose, is mainly responsible for giving us energy. There are other nutrients that also give us energy, such as lipids, among others. What happens when insulin does not work properly? If a person has low insulin or the insulin is not working properly, he/she will not only have high blood sugar, which causes damage to the whole organism, but also he/she is persistently inflamed. What does that mean? It means that your endothelia, those cells that line your blood vessels, are not functioning properly. In other words, there is excessive damage to all the cells in the body. If you are liking the video, give us a like and leave us your opinion in the comments box. Remember that we will be happy to read it. There are two types of diabetes, type 1 diabetes and type 2 diabetes. Let's start with type 1 diabetes. It is the one where there is a predominant deficit in the amount of insulin, that is, generally autoimmune. There are autoantibodies that attack the organ that produces insulin, in this case the pancreas. Inside the pancreas there are cells called beta cells. Beta cells have the capacity to produce insulin when these cells are attacked by antibodies. That is, our body recognizes these cells as foreign and destroys them. Then there is a deficiency of insulin. This is what usually occurs in type 1 diabetes. Type 2 diabetes. In this type of diabetes, what happens is that at the beginning there is a predominance of insulin resistance, which can be due to several reasons. When a person is overweight, there is a quantity of hormones called cower insulin, which leads to a decrease in insulin function. Being overweight is one of the main causes of insulin resistance. At first, our pancreas will react by releasing more insulin, but if we become more and more resistant, the amount of insulin will not be enough and it will fall below normal levels. Surely at the beginning there will be no insulin resistance, but eventually there could be resistance and deficiency. There are other types of diabetes, such as gestational diabetes. Gestational diabetes occurs when the body cannot produce enough insulin during pregnancy. During pregnancy, the body produces more hormones and also has other changes, such as weight gain. These changes cause the body's cells to use insulin less effectively. This condition is called insulin resistance. The important thing is that diabetes, if left undetected, accumulates disease in our body silently over the years, eventually causing us brutal damage that cannot be reversed. What are the signs and symptoms of diabetes? Generally, it is silent, and that is the problem. That is why we should always have a medical checkup as it should be, and within the medical checkup, sugar should be lost, especially in patients with metabolic diseases, obese, hypertensive, sedentary, among others. Now, there are certain symptoms that are typical of diabetes, such as excessive thirst and excessive urination to the patient. When sugar exceeds 180 milligrams per dl in our organism, the kidney filters it. That is to say, it is lost through urine. This sugar is accompanied by water, so the patient urinates a lot and therefore drinks a lot of water. Many patients with this type of thirst consume sodas, and these sodas increase sugar again, and it is a vicious circle. So we generate a lot of damage. In summary, two significant symptoms of diabetes are excessive thirst and excessive urination. In the case of type 1 diabetes, patients often lose weight. Remember, the problem is not in cower regulatory hormones, but some autoantibodies that destroy it, and these patients can debut with a complication called ketoacidosis, which we will talk about soon. If you like this type of content, we leave you one here below so you can continue to enjoy it. By the way, subscribe to the channel and activate the notification bell so that YouTube will notify you when we upload new content. How do I know if I have prediabetes or diabetes? Prediabetes is a condition in which we have a high risk of having diabetes in the next 3 to 5 years. In fact, it is said that about 30 to 40% of patients with prediabetes develop diabetes. How do we know this? Simple, through fasting blood studies that are done at any time, which is called melena glycosylated, or what is called oral glucose tolerance test. If you're a pre-diabetic person, you will have to make strict changes in the way you live in order not to develop diabetes. Check this out. If you have between 100 and 125 sugars fasting, you are pre-diabetic. In fact, some guidelines take 110 to 125, although this is up to your doctor to decide. However, the closer you are to 125, the more likely you are to develop diabetes. The glycosylated hemoglobin, which is called hemoglobin A1C. Hemoglobin A1C is a type of baseline hemoglobin. It's the one that lets us know how the average was. In other words, it is how the glycemia was in the last months, mainly in the last 2 months. Values between 6 and 6.5 of glycosylated hemoglobin tell us about prediabetes. Some values include up to 5.7. The problem with glycosylated hemoglobin is that it is not accepted in all countries because there is a lot of discrepancy between different kids. It is an extremely useful method not only for the follow-up and treatment of diabetes, but also for diagnosis. The oral glucose tolerance test allows us to get a head start. When we take sugar in this test, in fact, they make us take sugar. They take our blood before and after 2 hours and see how the sugar is in the post-sugar intake. Prediabetes and diabetes. If you are pre-diabetic, you will have to take much better care of yourself. A person with prediabetes has high blood sugar levels, but not yet in the diabetic range. There is still time to control levels and prevent diabetes from developing. If a person with prediabetes knows what action to take, he or she can most likely prevent diabetes from developing. Prevention plans generally involve two key lifestyle factors: a healthy diet and regular exercise. If you are a diabetic, the problem with diabetes is that it is forever. Diabetes cannot be cured, although there are cases where patients make very radical lifestyle changes, delaying the disease with various treatments. If you are liking the video, do not hesitate to give us a like and leave a comment on the subject. It is very important to know this because diabetes, again, is silent and many times we discover it. In the case of type 1 diabetes, when the patient has a ketoacidosis, or in the case of type 2 diabetes, when we have micro or macrovascular complications. What am I talking about? Microvascular complications refer to retinopathy, that is, damage to the retina that eventually leads us to blindness or decreased visual acuity. Neuropathy that leads to unbearable pain. Lower limb injuries that do not heal, not only due to neuropathy, but also due to vasculopathy, that is, damage to the blood vessels of the lower limbs, where these ulcers that appear in the lower limbs do not heal, become infected, and these patients end up as amputees. Another consequence of neuropathy, that sexual dysfunction in poorly controlled diabetic patients and macrovascular complications refer to that cause, which is known as atherosclerosis. As you know, the atheroma plaques that form in our body are formed because generally the cells that line the blood vessels, called endothelial cells, are inflamed, they are damaged. If you have a lot of cholesterol around, you have a lot of materials that oxidize you, that generate oxidation and produce damage, then fat is deposited and plaques are generated. These plaques eventually grow and obstruct the lumen, or rupture, and generate a heart attack, a CBA, a vascular disease, among others. The good thing is that all these complications can be avoided, delayed, or improved with respect to ketoacidosis. What is ketoacidosis? Ketoacidosis is a condition, usually not always of type 1 diabetic, and usually is the form in which diabetes presents in young patients, as it is known, diabetes, which destroys the pancreas. These patients. Ketoacidosis is a very serious condition where glycemia values are very high, between 3, 4, 5, and 600 sugars. In addition, what are called ketone bodies are generated. These ketone bodies are acidic. In fact, when we are fasting, ketone bodies help us to nourish ourselves. But when we are diabetic and the insulin level is very low, ketone bodies are formed in excess. That excess of ketone bodies acidifies the blood, causes coma. The patient begins to fall asleep and go into a state of coma. One could say that it can even lead to death if not treated correctly. I am sure you are wondering, how do we avoid the complications of diabetes? What is your treatment and how is it? Very simple. Changes in our daily life habits and pharmacological treatment if necessary. Habit changes are very simple. Exercise. How much? At least 3 to 5 times a week. If you can do it 7 days, do it at least 30 to 40 minutes a day. What exercises to do? Whatever you prefer. Any exercise is better than no exercise. Change details of your life is essential. Do not go down the elevator. Go down the stairs. Do not leave the car in front of your work. Leave 6-7 blocks away and walk like this. Small changes that allow your body to be in motion, that allow your body to make the muscles work and consume that excess sugar that is there. Foods that you should not consume. On the other hand, do not consume ultra-processed, fatty, canned, processed red meat, junk food such as hamburgers, potato chips, all these types of food. Foods you can eat. Eat a lot of fish, eat a lot of chicken, eat red meat, but eat fresh red meat. Eat a lot of fruits and vegetables. Eat oils derived from nuts, fish, and so on. Making small changes that will improve your life. Reduce the amount of stress. Get up 15 minutes earlier. Do meditation if it helps. Read a book. Take time for yourself. Medical treatment. Once we reach a certain point, medical treatment is essential. Many of you should know what is called metformin. Many patients think that sugar will drop to dangerous levels, that is to say, produce a decrease in glycemia, hypoglycemia to use the information. This is false. Metformin in no way causes hypoglycemia because it is not a hypoglycemic. It prevents blood sugar from rising, but it does not lower it well. So, understanding this, the same form is a fundamental medication that your doctor will surely give you if you suffer from diabetes. There are other very novel medications. Now these medications make our kidneys not recover the lost sugar, and by not recovering it, a quantity of sugar is lost through urine. This decreases cardiovascular deaths, kidney disease, heart disease, improves diabetes. So, if you are diabetic, ask your doctor about metformin treatment, about SGLT2 treatments, and lifestyle changes. Don't forget this. Between all of us, we can have a healthier life if we have the right information. That's all for today's video. If you liked the video, don't forget to give us a like, subscribe, and turn on the notification bell so YouTube will notify you every time we upload new content. See you in the next video.